Hi, everybody. I think it is officially afternoon, no matter where you're coming from. So, good afternoon, everybody. I'm Amanda Pierce Kelly. I'm the CEO for the Association of Clinicians for the Underserved. We were giving folks another minute or so to be able to join, and we're just, going to work through introductions and housekeeping here at the onset. But really appreciate everybody joining us and taking the time. Um, we have this scheduled for an hour. I don't know if it will go that long, so you may end up with some time back, which is always useful, especially as we head into the holiday season or are squarely in the holiday season. But really, today's conversation is just about what happened in 2025 as it relates to policy and advocacy, the work that ACU has been focused on, and some of the priorities that we hold near and dear, and then a bit of an outlook, projecting at least through Q1, probably not a whole lot further than that for the moment, because things are still coming together. And to some degree, we want to be able to create space for agility and responsiveness as they continue to unfold. But that's really the crux of the conversation today. And Rick, if you want to go on to the next slide, I'll just walk through the agenda. So we're going to start with a federal update. We do have some updates in terms of HRSA partnerships. We had a really great meeting earlier this week with some HRSA colleagues at the Bureau of Health Workforce. We'll talk a bit about our advocacy update. As I mentioned, sort of a look ahead into 26, at least through Q1, Q2. And then hopefully we can open it up for some discussion and answer questions. And, we really appreciate hearing from you all in terms of what this looks like on the ground, issues that are near and dear and where you have concerns and or see opportunities, because I think there's a fair number of those as well. Before we dive into the federal update, though, I want to introduce our other speaker who's joining us here today, Margaret French. She is a fantastic colleague. She has been supporting ACU on our policy and advocacy work since this summer and or early fall and summer, early fall. And we're just very, very grateful to have her. So, but Margaret, do you want to introduce yourself really quick?
Absolutely. Yeah, thanks, Amanda. Hi, everyone. I'm really excited to be here and be working with ACU. The work that you guys do is so important to rural and underserved communities and really the health ecosystem overall. So really, really grateful to be able to support the National Health Service Corps and all the great work on workforce issues writ large that ACU does. You really have a great reputation in Washington, D.C. So again, just really pleased to be part of the team. My background is here in Washington. I did some time on the Hill with Senators Grassley and Ernst. I've had a couple of different hats that I've worn since then, downtown on behalf of physicians and safety net hospitals most recently. And a couple years ago, I transitioned into the multi-client space to be able to work with a greater variety of folks that represent the healthcare safety net. So ACU being one of those organizations. Great to be with you. Happy to connect with anyone. I'll share my email out in the chat now. But yes, always open to hear what's going on the ground, especially it's really helpful for me to be able to pass on the message here in Washington. But you guys are the experts of what's happening on the ground and really where those pain points are. So it's really an honor to be able to represent you here in Washington. So I look forward to working with you more.
Thanks, Margaret. So just a couple of quick reminders as we dive, and then Rick, we can move on to the next slide. But if you have questions, you can put them in the chat or raise your hand. It's pretty informal, and actually, we're a small enough group that I think we can probably allow folks to come off mute, and then we can just have a conversation. That'll go for later in the presentation as well, just for discussion's sake. But if you are more inclined to just pop a comment into the chat box, we can take it up that way. Don't feel like you have to wait to the end if you need clarification or you have questions. Happy to do that real time as we're going through this. I do want to call out also Rick Brown and Josh, who are on the ACU team, who helped to produce this today and manage it and are just such incredible assets to the ACU team and bring such incredible value. And then Rachel Pratt, who supports Margaret and ACU. So you may see them here in the presentation box, if you will. But there's a wide team at ACU, some of whom work on programming, and others who touch the policy and advocacy space. But so by no means, is it just Margaret and I, but just really pleased to be able to have the conversation. So let's get started. I think Margaret is going to kick us off with sort of a federal update and sort of where things are, what, a little bit of a review of the last 12 months. It's hard to believe some days I feel like it's been 10 years, and other days I feel like, holy smokes, that year flew by. So, Margaret, I'll turn it over to you for the federal update.
Absolutely. Thanks, Amanda. And just to do some level setting, this year, even by Washington standards, was pretty unprecedented for two reasons. One, there were over 220 and counting executive orders from the Trump administration. Just so far this year, to give you some context, I think the Biden administration had around 60 in their entire 4 years. The Trump administration has already surpassed the number of executive orders that they did in their entire first 4 years, Trump 43. So it has been just a nonstop barrage, flood the zone, so to speak, from the regulatory space, which has really had the interesting impact of Congress sort of taking a little bit more of a back seat in terms of driving health policy specifically, but also sort of across the whole political ecosystem. Really, there have been two main pieces of legislation, one, two, that have gone through both chambers and been signed by the president. There were a couple smaller bills, but the two I'm talking about were one in March, which funded the government through September, and then we had a little bit of a break. And then, of course, H.R. 1, which was the reconciliation bill that Republicans voted on a party line to advance. There were a number of provisions in the healthcare space, mostly in the Medicaid space, unfortunately, that are going to definitely have an impact on the communities you serve. We won't necessarily see some of those impacts for 1 to 2 years. Next year, the Trump administration is really going to promulgate rulemaking. Oh my gosh, Chad, that is the loaded question. I'll get to it in a minute. So the rulemaking that implements all of HR 1 is still to come. So while the law has been passed, really all of those changes we're going to start to see in 2026, with the most of the impact taking effect in 2027. So that's something to be aware of. That's something ACU is certainly tracking. But to fast forward a little bit to more of the near term, as you are all likely aware, there was the longest shutdown in US government history just this fall, starting on September 30th, lasting through the month of October. It was 35 days in total. And what made this shutdown especially interesting is that Speaker Johnson actually adjourned the House, and they were not in session at all. Typically, despite a government shutdown, the members themselves will remain in Washington to work through the logjam on the appropriations process. That did not happen this year. The House left, they were back in their states and districts, and they weren't even in town. The Senate, the upper chamber, was here, and they were really the ones that were driving the resolution in terms of bringing that shutdown to a close. The shutdown was ended based on an agreement for a vote. Democrats really held the line in terms of the advanced premium tax credits under the Affordable Care Act. Those advanced premium tax credits allow low and middle income families to afford what have been skyrocketing rates for insurance premiums. Simply stated, without those tax credits, many of those families and individuals will fall out of coverage and become uninsured. So that is something that the community is preparing for. That, in conjunction with the Medicaid changes I referenced earlier, is really setting up a big influx of Medicaid and uninsured patients that you all are going to be treating, and your administrations are going to have to figure out how they're going to be able to continue to serve all those patients. So I don't want to be all doom and gloom. There is some good work on the horizon that I want to speak to. We have been working extremely closely with members of Congress, and we are really excited that there will be a piece of legislation introduced in the first quarter of 2026 that drastically would expand the amount of funding for the National Health Service Corps. The legislation also will seek to make some modernizations of the Corps to ensure that participants are able to serve and are able to have the flexibilities that come with modern life, parental leave, things like that. So that's still to come, but we have been hard at work this whole year, kind of laying the groundwork for that legislation, and we're really excited to continue to work with those offices and move it forward. The other big piece that we're, of course, focused on is the public health extenders writ large. So not only the National Health Service Corps, but the Teaching Health Center GME program and the Community Health Center Fund. Those were all extended on a short-term basis when the government reopened, but we are continuing to work with congressional leadership to find a longer-term solution. We understand that the uncertainty makes it incredibly difficult, to plan for any sort of change in the workforce, to grow and develop any sort of pipeline, and also just to continue the services that you all provide day in and day out. So that's what's been happening this year. There's going to be a big flurry of activity in January before this January 30th deadline on the public health extenders, which ACU, of course, will be weighing in on. And then hopefully we'll have a little bit more of an opportunity to focus on less firefighting and crises and more longer term planning and sustaining and supporting the healthcare workforce. Chad, what do you think is prompting the historic amount of EOs and disregard of congressional power? It's Congress. It's their fault. I mean, this is something that has been happening for over 10 years as we have continued to see Congress really decline to weigh in and do the hard work of compromise and moving policy forward. They would rather sort of kick the can towards the executive to make a lot of the changes. This is something that we definitely saw even before the Obama administration, but really during the Obama administration. And then also, Trump has just taken this to the nth degree, really stretching the power of the executive and happy to fight the battles in court on the back end. Instead of sort of asking for permission beforehand, they just go ahead and push the bounds of the policies, whether it's legal or not. So I place the blame for that squarely at Congress's feet. I think a lot of things have changed in terms of technology and the access to members, and members' wants and needs have changed. And perhaps those that are true public servants are fewer and farther in between, although many, many of them remain. But unfortunately, Congress needs to step up and take that power back, but starting with a full appropriations term. Could you expand more on what's in the new National Health Service Corps legislation? Rosie, I wish I could. We have seen just a very brief overarching draft. I can say that the draft did include ACU's ask of increasing funding for the Corps to $950 million. That is the biggest win in the policy. So we know the funding piece is there. In terms of some of the modernization that I spoke about, they're not there yet on the policy, which is why they haven't dropped the bill. They're still working. They need to go through the technical advisory process with HRSA. But after that process takes place, we'll have an updated draft, and we will certainly share out as much as we can, as soon as we can, with this group.
Rosie, the other thing that I would share is that while it is not settled yet in terms of the modernization that Margaret was referencing, most of which, really all of which came from as a result of the survey that ACU did with our network in the field about, what are the biggest challenges and what are the areas that if changed, would, enable greater engagement in the core, et cetera. Everything came from that. And conversations with the Congresswoman's office has been informed by that, including, bringing in ACU members and a couple of our board members to just have conversations about, this is what this challenge actually looks like. And so I'm really excited because it's close. I think to Margaret's point, there's still procedurally, there's still steps to be taken in terms of like working through the technical and, you know, is this statute? Is this within administrative ability? That kind of thing. But I do feel really positive about the understanding that the Congresswoman has for the challenges that we flagged, frankly, and the commitment and intention to weave as many of those into this as possible. The other thing I was going to mention, just in terms of federal update, is that it's definitely we have found ourselves in a storm this past year. I'm not going to diminish that, but I do think that there are some opportunities, and some of you who have maybe heard me speak in other settings have heard this from me, but a couple of things that I would call out is that a few things. If we look at just what's happened this fall, I think coming out of the election and then also just thinking about, kind of if there's anything positive that came out of a shutdown, which it's hard to come up with anything positive from a shutdown. But I think the attention on healthcare and the elevation of healthcare as a priority in Congress definitely happened as a result of those things. And so what that will look like is still to be determined, but I think it offers an opportunity to really drive at the importance of workforce policy within what is to be in terms of healthcare as a rising priority, and specifically National Health Service Corps. The other thing that I would call out, and there's a lot of there's politics linked to this, although if you take the politics out, I think Make America Healthy Again actually does really provide an opportunity for further investment, attention, and um, interest in healthcare workforce. And again, I think specifically National Health Service Corps, Teaching Health Center, and I think some other programs, just by nature of the fact that if there's going to be this investment into primary care in order to achieve and drive the goals and the framework of Make America Healthy Again, you're going to have healthcare workforce equipped to be able to drive that. Everyone on the call, I imagine, is very well aware, and I'd be preaching to the choir to say, healthcare workforce shortages is not something new. We've been dealing with this for a long time. It got worse during COVID for a variety of reasons, and it's not headed in the right direction. And so I think by virtue of the fact that we will have to, and we already are having to contend with that, but I think some of the priorities and the attention on things like Make America Healthy Again, on healthcare as a rising priority once again, is going to be really helpful and provide an opportunity in terms of what we can do to drive programs like the National Health Service Corps. But quite frankly, I think also just supporting healthcare workforce, caring for underserved populations in general. I think we're going to see more and more of that. Rebecca's question here, any updates around advocacy to health centers not being required to have increased administrative burden, and financial impacts of the new 340B rebate pilot? Yes, those are great questions wrapped into one, Rebecca. So, and two different things. Margaret, do you want to chime in, or I can start? Which do you want to chime
Yeah,
in?
we continue to ask for health centers to be carved out completely of the rebate model. Um, it's frankly ridiculous that they were included in this model. They're 5% of the program. Everyone, policymakers and stakeholders, understand that CHCs are not the problem in 340B. Yet, unfortunately, every time actions are taken or proposed to address those bad behaviors, CHCs are the ones that are feeling a disproportionate burden. We continue to make that point. We have asked to be carved out. We've asked Congress to carve us out. We've asked HRSA to carve us out. Amanda has asked, I think, Tom Angles to his face multiple times to help us. I think there's an understanding that we're in a different place, but The reality is, on the legal front, they were basically told by the attorneys that in carving us out would leave them vulnerable to challenges from the hospital systems in a greater fashion than if this applied equally to all covered entities. Um, it's so frustrating to hear that. We know that we're doing wrong by you, but we're doing it anyway message. But again, it's not all doom and gloom. We have heard from the Senate Gang of Six that they intend to address the rebate model in their revamped Sustain Act, which was the discussion draft they put out in the previous Congress that addresses a lot of things, including contract pharmacy, protections, bad behaviors by PBMs, et cetera. So I guess it's a trust, wait, and see moment. I'm not inclined to wait and see. So we're going to continue to urge lawmakers to put pressure on HRSA and HHS at the political level to carve health centers out, and if not carve them out, to delay implementation, and if not delay implementation, to replace those desperately needed resources in another manner.
Yeah, I was just going to say, I think there's sort of two parallel efforts going on right now with that, Rebecca. A lot of it is efforts at carving out entirely, although Margaret's flag around the legal limitations of what that may or may not look like. But I think if not a carve out, just a delay, like it feels like there's not been adequate preparation for a variety of reasons. I'm also, I think everyone is sort of waiting to see what's happening. With the lawsuit and what's going to happen on the legal side of things too, and if that may create a delay as they work through that. So definitely something that we've been really active on. ACU partners really closely with ACH on that work in particular, but certainly we'll keep you guys updated. I mean, we're down to the wire, so to speak. But ACH had some really good meetings just couple of weeks ago now with CMS, with the folks who oversee this. I know there have been ongoing conversations with Engels and Dr. Oz. And so, we'll see. There's still a chance that we'll see at least a delay, if not a carve out. So stay tuned. Kathy, I see her, and Rick, we can go on to the next slide. I think actually Kathy's question is a good segue to our discussion with on the HRSA partnership. But just in terms of your question about if NPs and PAs, as well as behavioral health healthcare workers, are declassified as professionals, is that going to impact National Health Service Corps loan repayment? I don't, we've not heard that. And it is a good segue because we just had a meeting with Candace Chen and Israel and the BHW team a couple days ago. And so if that was something that was kind of tracking, Kathy, I think we would have heard it in that meeting and we did not. So I'm really pleased about that. Our reason for sitting with them, which we do, as often as we can, but periodically throughout the year, was to connect on a number of different things. One, the survey results that we did in terms of challenges and barriers that exist within National Health Service Corps space, at least as experienced by the network and the field. To also have a conversation about some of the discussions we've had with the Congresswoman about the legislation that's coming up and ongoing funding. But then also just sort of what is it that ACU can do to help? There are so many different grant programs and different programs in general underneath BHW. And part of the discussion is really around how can ACU help support visibility and awareness and frankly, greater engagement, taking advantage or better advantage of all of the different programs and grants that exist under BHW. I think the reality is that, and one of the things that I'll call out and sort of stay tuned, put a pin in it for after the first of the year, I think we're going to end up doing at least one, if not more, webinar with BHW to dispel some of the myths that exist actually in terms of National Health Service Corps, some of the survey findings. It was really interesting because we sat with the BHW team and they were like, well, this isn't actually a requirement. We don't enforce this, or this isn't actually in the statute. But the reality is the survey tells us that people are under the impression that things like a fitness requirement, for example, is a required element in terms of entry into National Health Service Corps. And so, one, while that's not the case, where is that originating from? Is that coming from, the state level? Is that health center organization based? Like wherever that misnomer exists, we want to work with BHW to dispel some of those myths and help to, empower people further. We also spent some time talking about they are in the process, they being HRSA, but specifically BHW and Bureau of Primary Healthcare are in the process of revisiting and revising MUA, MUP. And I know that can cause a lot of anxiety, understandably. But it was a very good conversation. There wasn't a lot of information that they could share in terms of specifics and what that's going to look like. But what we were told was that probably end of the spring, early summer, we would see something at least initial coming out. We did have some really great conversations about the reality of how kind of updating MUA, MUP looks different from an urban to a rural scenario, for example. But I think also just, and I was so grateful because Candace really was clear and understanding of, there are grantees right now and designations right now that are decades old. But maybe in an urban area, they've gentrified, and so the location of the health center today looks very different than it did when it was first funded. But the reality is the patients that are coming to the health center continue to be those that are coming in, and we're serving that underserved population. They may not live within 10 blocks of the health center, but they are still accessing that health center for the right reasons and with the same intention. And so that isn't to say we won't see updates, but I was appreciative of the recognition of the realities, and that what we are trying to do. And I think the overarching goal is just making sure that updates take into account the true intent and the foundation of the program, but really revisiting, okay, what does this look like? So more to come on that front, I think, but I know that's a question that has come up often, and it was the first time that I had heard sort of a specific timeline in terms of end of the spring, early summer. Margaret, do you want to speak to Title VII, Title VIII, and just kind of digging in on that a little bit?
Yeah, I do. So unfortunately, coinciding with the September 30th end of the fiscal year and government shutdown, although this wasn't because of the government shutdown, the authorizations for HRSA Title VII and Title VIII have lapsed. So I know most of you know this, but just as a refresher, there's an authorization process, which basically gives permission to the appropriators to then fund specifically that program. So it's a two-part authorize and then appropriate for funding. And when an authorization lapses, appropriators sometimes appropriate anyway. But the risk, especially in this Trump administration, is without that express intent from Congress, the administration is able to move those funds around and simply choose not to fund certain programs under Title VII and Title VIII. Title VII specifically addresses underserved communities, disadvantaged students, seeks to have a greater access equity for those that maybe come from underrepresented populations or areas of the country. This has been incredibly important in order to build that pipeline of folks and, frankly, give equal opportunity to the health professions for some of these communities. Title VIII exclusively deals with nursing programs and also includes the Nurse Corps, which we care very much about. So again, without these authorizations at the congressional level, Candace Chen and her team at BHW's hands are a little bit tied. They're not able to necessarily protect those dollars and keep them in Title VII and Title VIII if folks from HHS are sending a directive down to move those monies around. We are hopeful. So there have been reauthorizations bills introduced already in the House and Senate for Title VIII. I was actually speaking with Majority Committee at the Help Committee earlier today about Title VII. We expected the Senate Title VII bill to drop this week, but given sort of the disagreements over the ACA as well as what's happening on the appropriations side, they basically just got backtracked. So we're hopeful to see something next week before the end of the year, but that would mean that they would drop the bill during pro forma when members aren't there, and members don't always love doing that. The sooner we see that bill, the sooner the committee can start to work on moving the process forward. The majority staff have indicated to me that Chair Cassidy wants as clean as possible, straight reauthorization of both Title VII and Title VIII, which in this environment is honestly a miracle that he supports that. Now, some of the down dais conservative members may not support a lot of the programs in Title VII, which is why the chair really wants to move in a clean, kind of quick fashion to move both of these titles forward. Unfortunately, progress has stalled on Title VII in the House, so we really are looking for the Senate to push this through on our behalf. Once those authorizations do come down, HRSA has a lot more certainty in terms of keeping the money that has been appropriated and that will be appropriated within their control.
I think if there aren't any questions on this one, we can probably go on to the next slide. All right, so this is one of my favorite topics. We get to talk about advocacy and what's happening. So one of the things that I would call out right off the bat as we head into 2026, we are having our annual conference. Of course, the theme this year is riding the wave of transformation, all hands on deck. Kind of a fun play there, but it is about transformation. I think change can be challenging, of course, but it can also be really amazing. And from that change can come really incredible opportunities. And so that'll be the focus of the conference coming up July 26th to the 29th. Congress is in session. Usually ACU's conference is 1 week later and they are gone. They've already, especially in an election year, they would have left and ready to go home and campaign and do everything. But we're a week earlier this year, and so we will have a Hill Day, and I think most folks will be in town, which is awesome. And I have every reason to believe that it will continue to be a really vital time to be having conversations on the Hill. Certainly about National Health Service Corps, but I think about funding, about sort of the bigger picture of what's happening with healthcare workforce and some of the things that Margaret just mentioned. The reality is, in terms of our advocacy and what we're looking at in the year ahead, is that we really need to have a long-term investment made in the core. And it's much the same as I think most of you know on the call. Same thing with health center funding, same thing with teaching health center funding. Some of the things that have already happened. We did do a letter with ACH and the Teaching Health Center Association about needing that long-term solution and that long-term investment. There is currently a Republican-only sign-on letter that's circulating. And so in terms of advocacy, this is a really great opportunity for folks to be in touch base, have conversations about what's at risk, in terms of the unpredictability and the instability with funding for National Health Service Corps and for health center funding and teaching health centers for that matter. And then the other piece that is going to be coming up that Margaret has mentioned is that we do expect to have legislation coming forward in the first quarter of 2026. So we'll be very diligent in terms of our advocacy to drive that forward, probably looking for co-sponsors and engaging all of you and our advocacy network to help pick that up and move it forward. Margaret, do you want to speak to the Workforce Expansion Act?
Yeah, so this is a piece of legislation that is authored by Senator Bernie Sanders of Vermont. And this bill which ACU has endorsed. This bill is more of a marker bill in terms of recognizing need. It's very unlikely this will advance, but we thought it was important to put our mark down as well, so to speak. The bill offers tuition-free medical, nursing, and dental education in exchange for commitments to practice in underserved areas, and really aims to boost enrollment in health schools, fund, expansion for public health workers, and incentivize providers to be more active enrolled in underserved communities. Again, there's no Republican on the bill, so it's not bipartisan, and it has not yet been scored, but would be exorbitantly expensive. So once again, this is not something we expect to be signed into law, but the need for the pipeline to be expanded is so great that we felt it was important to put our name on this bill in support. So I can actually link. This is the congress.gov link to the bill if anyone's interested in clicking through. The text is available and would encourage you to just take a look if you're curious.
Thanks, Margaret. The other thing that I would just want to call out is that we, ACU, along with ACH, the National Medical Association, and the National Association of Rural Health Clinics, launched the Alliance to Strengthen America's Health Workforce for the Underserved, which we fondly call the Alliance just because it's a long name. This is something that ACU has been talking about for a couple years. And I'm so thrilled to be able to have launched this alliance and to serve on the executive committee, to be one of the founding members. The alliance is really dedicated to advancing policy that supports healthcare workforce serving the underserved specifically. And so there's a lot of really great work going on for different disciplines, of course, different professional organizations, and there are workforce coalitions, healthcare workforce coalitions out there that are doing good work, but there isn't one, or there wasn't until the Alliance, that was specifically dedicated to healthcare workforce caring for underserved populations. So not surprising that ACU was a founding member and a driving force behind this. We are about a month in. The organizations I mentioned make up the founders and the executive committee, but we have, I think, 7 or 8 other organizations, national organizations, that have officially joined on as a part of the Alliance. And really what we'll be doing is trying to advance those policies, as I mentioned. And so there will be focus on National Health Service Corps, on Title VII, Title VIII. I think it's an opportunity for this wonderful, wonderful coalition of national organizations to come together around different policies and the need for resources to support education, training, and programs that are really going to ensure specific investment and infusion in these underserved communities specifically, because as you all know, or you're on the call for a reason, it looks very different, in the underserved communities. And so we just this week actually pushed our website for the Alliance and a press release out. So folks, thank you, Rick, for putting that forward. You can take a look. If you have questions or you want more information, of course, let us know. But just really thrilled. Like I said, this is something that we've been talking about for quite some time. And so to see it come off the ground is exciting. And there's a lot of work to do in 2026. And so I think the power of the Alliance and having that coalition of voices is going to be very impactful. So anything else you'd add, Margaret?
Just that we're new. We've only been around 2 months now, really, and just publicly launched. So I'm really excited to see this alliance grow. One thing that we really wanted to do is ensure that we were representing all providers and clinicians across kind of the whole healthcare continuum, not just focusing on, docs and nurses, but really ensuring that, the dental schools and the PA folks and all of those communities are also represented. We want to have a big tent, so to speak, with the uniting factor being the underserved communities that they focus on. So if you know of folks that would be good organizations for us to include in the Alliance, we are always happy to have new members join. And if there are folks that are missing, they're even more important to us to have their voices be raised up and heard. So excited to kind of work outside of our traditional space, I would say, with some others that really play important roles in underserved communities.
I think you can go on to the next slide, Rick. All right. So, what are we looking ahead toward? And we've talked about a couple of these things already, so we can probably go through this pretty quickly. But Margaret, do you want to tackle these, and I can kind of chime in here and there?
Absolutely. So again, anything can happen. With President Trump and Secretary Kennedy and the cast of characters on the Hill, changes and quick pivots happen all the time. So we're always being prepared for those. But we do have some certainty for the first part of the year, including the legislation that we mentioned that would have expand the number of funding to 950 million for the National Health Service Corps. Also, Amanda spoke to the conference, great opportunity to really build your networks. Again, maybe outside of your specific spaces. That's the whole point of bringing everyone together, share best practices and convenings. We're excited about that. And one thing that we have not talked about yet, but will really be dominating a lot of the discussion next year is it's an election year. Midterm elections are in November, but members of Congress are already well into their campaigns. So during election years, there can be some distractions, but also a lot of opportunities to engage in things like site visits with your representatives, encouraging staff during the October and August recesses to engage with you, making sure that you know or and are engaging with the district directors for your representatives is really key, especially during an election year. You see policymakers want to maybe be a little bit more public about visiting folks such as yourselves. So there's a ton of opportunities for relationship building that is really, really important during a midterm election year. And then I think
Yeah, I think we can go on to the next
go
slide, and
to
I
the
think we,
discussion.
yeah, we just open it up for discussion. So I think at
Maybe
this
one
point,
more slide though.
yep, one more.
Yeah. So these are just some questions to get you all thinking and started, but I would love to hear any reactions to any of the federal updates, the HRSA stuff that we shared, as well as things that you really could use ACU's help with. We want to be sure that we're serving our members appropriately. So would encourage you to come off mute or enter some thoughts in the chat, and we're happy to kind of open it up.
I also appreciate the questions real time too. So, but to echo Margaret, we're constantly trying to add resources and think about what would be most helpful in terms of making engagement and advocacy easier. So, certainly whether it's training or more background information, whatever tools you guys need, any suggestions are always welcome and something that we want to try to jump on. And then I think the first question there, I think um, we're focused on the challenges, but I actually would say what's working really well is one thing. I mean, it says what's working well and one challenge, but I don't want to dismiss the challenges. There are many, but I am really excited about what you all have been able to do to address some of the challenges on your own. And part of the reason I bring that up is that we hear that on the Hill a lot, or at least I do, where it's this question of like, well, what are people doing and how are they doing it? Or they want to hear about innovation, or they want to hear about solutions, probably because 90% of their meetings is focused on what's not working. And so when you're able to flip that to say, here's an example of something that's going really well. We just need more support or resources or the policy, whatever the case may be. And so welcome that from you guys as well. Well, I'm not surprised that folks are feeling quiet as we head toward what I hope can be some downtime with friends and family for the holiday season. But we'll give it one more minute and see if folks have anything they want to put in the chat or raise a hand. Okay. Well, we will get about 12 or 13 minutes back. Thank you, Rebecca. We really appreciate you too. As I started, really grateful that you guys took the time to join us today. There's going to be some really good stuff coming out at the beginning of the year. We'll hit the ground running with both advocacy calls to action, but also sort of updates on some of the things that we talked about today. And otherwise, have a really wonderful holiday season. Thank you for everything that you're doing. We're here to help. So please don't be strangers. And we'll look forward to our next conversation. Thanks, everybody.
Thanks.